Well, good afternoon, everyone, and thanks for joining us. I'd like to welcome you to this Monday Minute Live Chat hosted by the Canadian Leadership Congress. Our topic today is all about innovation in the healthcare sector and what investment opportunities that presents for asset owners. And to help us with this is Rose Nguyen, who's a portfolio manager in healthcare innovation strategy with Baillie Gifford. And with that said, I'd like to get started. Welcome, Rose.
Thank you, Caroline. Thank you for having me.
Yeah. So for those of you who are interested in asking Rose a question after today's Monday Minute, please send an email to info@leadershipcongress.ca and we'll make sure your question gets answered and sent back to you. And we'll repeat that email at the end of the session. But with that in mind, let's get started. So Rose, I have a first question for you, and it's pretty timely. Like everyone, I'm really glad to see the end of 2020, as are many of us. But from a healthcare innovation standpoint, I can imagine it must have been quite an interesting experience. And from your standpoint, did the pandemic shape or influence how you view innovation in healthcare?
Thank you for the question, Caroline. So yeah, like yourself, I was so very happy to see the end of 2020 and cannot wait to go back to normal. But last year was truly a devastating year for humanity and the global economy. It was also a real stress test for the healthcare industry. But the good thing is that most companies in the sector remain resilient, and many even stepped up their investments during this period to help us fight against COVID-19 and innovate our ways out of the pandemic. So I think for me, the silver lining here is that this crisis can serve as a huge catalyst for change. And I think it's going to accelerate a lot of innovation in healthcare for a few reasons. So first of all, I think the pandemic really broke down a lot of inertia, and it really forced doctors, patients and healthcare systems to adopt new technologies like they never did before. And one good example is telemedicine, as you can see. For many years, doctors and patients resisted telemedicine, and people basically treated it as a cheaper and inferior alternative to normal doctor visits. And then the pandemic came, and it obviously changed all of this overnight. So during the peak of March, April, about 70% of all health visits in the US were done virtually. And even though that number has come down to around 20% in recent months, that is still significantly higher than the level we saw before the pandemic, which was less than 0.1% of total visits. So, I think the pandemic has helped people recognize the benefits of many of these technologies like telemedicine. And that's why I think, they are here to stay for the long term. And I think, just another reason why, I think the pandemic has, really accelerated healthcare innovation is that it really highlighted the importance of science and research. And that's why it's attracting a lot of capital from both, investors and nonprofit funding into this area. And that amount of capital will again help companies strengthen their financial positions, increase R&D activities, and fuel that pipeline of innovation.
That's great. And I love the comment about the use of video conferencing in healthcare. It's so important. So I guess my other question is, when it comes to innovation in healthcare, what are the innovations that are kind of getting you excited right now?
Yeah, so, telemedicine, I just mentioned is, one example of that. But I think, there's a lot going on in healthcare at the moment. And if I, perhaps can kind of, instead of mentioning specific innovations, I would like to perhaps mention some broader long-term development trends that I think are very exciting and have potential to transform this landscape. So the first one would be the shift of healthcare from brick and mortar to an online and data-driven world. And second would be novel classes of medicines. So, online and data. Well, we all know that, healthcare has been lagging behind so many other sectors in terms of embracing digital technologies, connectivity, and data analytics. But the pandemic has really accelerated this transition. And I think over the next 10, 20 years, we will see almost every aspect of the healthcare industry being transformed by these forces, which have produced exponential growth in the tech industry. So we are very interested in the companies that enable that sort of transformation. So this would include telehealth platforms, but also tech companies like Viva, which provides software and tools to help hospitals and biopharma companies operate much more efficiently. And the second very exciting development that I would like to point out is new classes of medicines. So currently, the most common and also the oldest drug class we have today are small molecules made from synthetic chemistry. But despite their popularity, they have a lot of limitations. But perhaps the most important one is that it's very challenging to make the discovery and development process of small molecules predictable and scalable. It's because each one is entirely different from another. So there's very little that we can learn from either success or failure of one drug, to improve the odds of success of future drugs. So that's why in the drug making business, the success rate remains very low. On average, only 1 in 10 drugs that are tested in human can make it to market. But the exciting thing is that in the past 5-10 years, we have seen a massive expansion in the number of new drug classes or new types of medicines. These will include proteins, RNA therapies, gene therapies, gene editing, and so on. And this is, for me, this is really exciting, not only because these new medicines can treat diseases that we couldn't treat previously, but also because they are much more scalable and they can potentially have much higher success rates compared to small molecules. And I think an evidence in point is a company that we have in the portfolios called Alnylam. It is a US biotech company that is leading in the field of RNA-based therapeutics. And for them, they have achieved a very impressive success rate, closer to 60%. So that's 6 times higher than the industry average, thanks to their scalable drug platform. So I think with these new classes of medicines that we are seeing that will come, that will become more mainstream over the next decade, the drug development process can be much more scalable. It can be cheaper, faster, and we can defy that conventional wisdom of drug making being risky and expensive.
That's great, and those are excellent comments, and especially around sort of the long-term play that a lot of these companies are focused on. But healthcare companies at the same time, you read a lot about the push for profitability and sort of adding shareholder value year after year. How do you square that with that investment in research and development when, to your point, some of this research isn't really necessarily going to lead to a saleable product, right? Like, how do you assess companies and push companies to be investing the way they need to in R&D?
No, that's a great question, and I think you're right that for many years, we have seen some big pharmaceutical companies, not increasing spending in R&D, but really increasing spending in marketing and advertising to commercialize their drugs. And then there has been a lot of pushback from patients, governments, and society on that front. But I think healthcare is an area where if you invest in research and development in a productive way, then the returns can be huge, and not just for shareholders, but also for patients and society. And so for us, our focus is really, trying to find a small number of companies that, we think have a very large potential of delivering that transformational change for human health and healthcare systems, and finding the companies that are willing to invest in R&D for the long term, even if that means sacrificing short-term profits. And the way we go about doing that is, at the end of the day, it really comes down to the people behind the business that are making decisions, right? So we place very strong emphasis on the management team and the company's culture when we, research the opportunities. So as part of our investment process, we spend lots of time talking to the management, building relationships with them, really to try and understand their ambitions for the company and the values that they stand by, and also really to really to see whether we can trust the management to do the right things for the business in the long term. So yeah, that's kind of how we go about and assess companies, whether they are investing in R&D for the right reasons. But having said that, I think, why do companies cut R&D fundings? And I think most of them do that in response to pressure from short-term shareholders. So that's why having a long-term supportive shareholder base is very important to allow the management to stay true to their ambitions, and to allow them to invest without worrying about upsetting their shareholders.
That's a great point. So innovation, it's a word that is used a lot these days in different contexts, and perhaps some could say overused. But in your own investment process, how do you assess which of these future opportunities have the most actual long-term value? And I mean, is that hard to do?
Yeah, well, that's a great question. There are so many opportunities and then so much innovation going on in healthcare at the moment that sometimes it can be quite hard to determine which companies or which ideas are worth investing in. Well, our approach is that we focus on extraordinary growth businesses. So for us, the companies that we invest in must, first of all, be addressing huge unmet needs in the market. All right, so for example, if you take a company that is producing a slightly better statin compared to other drugs that also lower cholesterol in the market out there, for us, that is more incremental innovation. Compare that to a company that is developing medicines for Alzheimer's disease, for example. That would be transformational innovation. And success in that case will imply huge positive impact for patients, society, and shareholders. But then taking a step further, we are not just interested in transformational innovation. We are interested in innovation that is also scalable. And I think that is a key point to emphasize, because scalability, to my mind, is really the key to repeating success and the key to increasing returns to scale. So, that's why in the area of biotech, for example, we tend to avoid investing in, single asset companies or those companies that, pursue a very specific disease pathway that we think is too narrow to be scalable. We much prefer companies whose, science and technologies can be applicable for many different diseases, many different indications. And so, once their underlying platforms are, validated or proven, then they can scale very quickly. And I think in those cases, those companies have a much higher chance of, being true outliers in terms of both the impact they can deliver, to their stakeholders and in terms of financial returns. And when it comes to, our research process, how we kind of go about and assess, those companies, we tend to value qualitative assessment a lot more than quantitative assessment. And we also, put strong emphasis on the ability to imagine, what a company can become in 10 years' time and what success might look like if things go right. Well, believe me, that's actually not something that is easy to do, because, the human instinct is that we prefer certainty, right? Like we tend to worry a lot and we want to run to safety. But it's often those opportunities that may seem too early or too risky that tend to provide the most long-term values.
So Rose, you and I were both users of the healthcare system, and everyone listening today is a user of the healthcare system and patients in some way. From your experience and where you stand, can you tell me a little bit about how you think our experience as patients will change in the next 20 years?
Wow, okay. That's a tough question. You know what, because like if my future predictions sound, any reasonable, then you can be sure that in 20 years time, the progress of, medicine and science would make me seem extremely conservative. And at the same time, if I, by any chance have a correct prediction, then it will sound so absurd and so unbelievable that, you may just laugh at me. But, I am an optimist, so I would rather be unbelievable. I think, so I think by 2040, right, every newborn baby will have their DNA sequenced at birth, together with, their gut microbiome. All of this information will be updated every year, because I guess by then the cost of sequencing will be so cheap, maybe as cheap as a blood test. And we will see technologies and data science advancing so much that we are very close to being able to completely decode the human biology. And that means, we will be able to build, complex systems to figure out the interaction between cells, genes, proteins, food, and so on. And we will finally understand the biology of, complex diseases like heart disease, Alzheimer's, diabetes, and so on. And so every one of us, you and me, we will probably have a virtual self where we can do tons of, simulations, and companies can test drugs on that virtual being of you and me. And so that's how you will get to truly personalized medicine on demand. And the whole process of, drug development can be shortened to perhaps a year or just a few months, right? And by 2040, I think, some new therapies like stem cell therapy and regenerative medicine will probably become mainstream as well. So, as a human being, as a consumer like you and me, we will probably have a lot of questions to think about, like, how are we going to, live now that we know if, something is wrong with our human organs or tissues, we can just, regenerate it with, stem cell therapies. So I think that will pose a lot of difficult and interesting questions for the individuals and also for society. But I think the future will be fantastic in 2040.
Well, it definitely sounds it. So, as we wrap up, you've talked about a lot of really interesting innovations, how things are going to change and improve in the decades ahead. But right now, for the purposes of our talk and our viewers who are long-term asset owners here in Canada and beyond, why is it so important, in your view, for them to have some exposure to healthcare now? Why are they such an important force in this?
Mhm. Yeah, so the setup of our strategy, health innovation at Baillie Gifford, it was purely driven by our excitement about the investment opportunities that we see in healthcare. And I think for asset owners and investors, the most compelling reason to invest in this sector is that there is rapid change going on in healthcare. When you look at the systems that we have today, the background challenges are very well known. So we have aging populations around the world, very high cost of medical treatment, and very outdated and inefficient healthcare infrastructure. This is very frustrating, right? Like to the individuals, but it also means that the opportunities for change are tremendous. And fortunately, we now have the technologies and the tools to enable those changes and to approach, healthcare in a different way. So for me personally, I believe that this is the century of biology, and we are probably living through one of the most exciting times in medicines, and this is really driven by the convergence of so many different technologies and sciences, and they are all now coming together to transform life sciences and healthcare. So I think over the next 10, 20 years, this is one of the best hunting grounds for great investment ideas. If you care about financial returns as well as positive impact that you can deliver on society, then I think this is a great area to consider to invest in.
Absolutely fascinating. This has been a terrific conversation, Rose, and I thank you very much for sharing your insights. It's a rapidly expanding and changing space, and it's been terrific talking to you about it. Thank you so much for sharing your thoughts today, Rose. It's been fascinating. And that wraps up this week's Monday Minute. Don't forget to send us your questions and we'll get right back to you with Rose's response. And I believe we're going to show the email info@leadershipcongress.ca as soon as this is done. And thank you all for joining us, and see you next time.
Thank you.